Hello, everybody. Good afternoon. Welcome all. I'll just let you settle in for a moment. Lovely to see so many people, some familiar names and some new names. My name's Claire Sieber. I'm a GP and I'm the co-CEO of the Well-Led Practice. And today we are running a webinar called Demystifying the New CQC Single Assessment Framework, because the CQC framework is changing. And you'll be introduced to some of our team today who will talk to you about different bits of the presentation. But it's really great to see so many of you here today. What we're going to cover briefly is the new CQC framework, and our colleague Gabby is going to speak to you about that. I'm going to give you our top 10 tips for ticking the environmental sustainability box, and Gabby will show the importance of why we've now got to start doing that. And then I'll hand over to my colleague Gary, an ex-practice manager, who will give you some insights from his role as a practice manager in achieving well-led. And then I'll hand over to Oscar, who will then take you through our well-led practice platform and how it can help you with your CQC well-led readiness. So these are us. You could probably see us along the top of your screen anyway. I've introduced myself briefly already. Other important things maybe you should know about me: I'm based down in West Sussex, and I recognise some local names on the list. I also work as a mediator. I mediate lots of conflicts between GP partners and practices and PCNs and employees working within the same surgeries. I've had some LMC and some GPC experience, although I don't do too much of that now. I spend a lot of my time these days focusing on leadership and conflict training for people working in general practice and primary care. So that's me. Oscar, can I come to you to introduce yourself?
Yeah, sure. Hi, everybody. Nice to meet you all kind of virtually. So I'm Oscar Matthew. My description is there on the screen for you. So I'm a lawyer by background, but I've spent the last decade or so working with healthcare teams, partnership groups of consultants, trying to help them work better together. And I'm also Claire's co-CEO with the Well-Led Practice. Hello. Over to Gabby, I suppose, next on the list.
Thanks, Oscar. Hi, everyone. Nice to see so many people here. So my name's Gabby Ashton. I am an ex-CQC inspector. So for about 4.5 years, I sat in the Adult Social Care Directorate down in East London as an inspector, and then did a little bit of work supporting the transition through COVID and through the single assessment framework. I now work for a local authority, supporting them to be CQC ready. For those of you who don't know, the single assessment framework now also applies to local authorities and integrated care systems as well. So spend a lot of time preparing for that. And then in my other time that I have, I run a CQC compliance consultancy company called Let's Make Lemonade. So nice to see you all. And I will hand over to Gary.
Hi, everyone. Yeah, it's familiar names. I'm seeing it in the attendees. So anyway, I'm an ex-practice manager, 13 years as a practice manager. I've also been a federation director and sat on a PCN board up until about a month ago. I now support primary care with facilitation, education, and a big part of that role is working with the team at Well-Led. Nice to meet everybody.
Thank you, Gary. So before we start in earnest, just to let you know, you will get the slides at the end. We'll give you a tiny little feedback questionnaire to fill in, and as a result of doing so, you will then get the slides. So no need to frantically make notes, take down links, etc. You'll get it all emailed to you after the event. And please feel free to ask questions as we go along, although we might answer them all at the end. But as you're thinking of them, if you could pop anything that you'd like to know in the chat box, then we will come to it at the end, if not before. So do get your questions ready. So I'll now hand over to Gabby, who's going to introduce the new CQC framework.
Thanks, Claire. Okay, so there's a little bit of, we're just going to spend a little bit of time now looking at demystifying the CQC strategy and talking about some of the fundamental changes, but also reassuring you about some of the things that aren't changing, so it doesn't feel as overwhelming as it sometimes can feel. So in terms of what is staying the same, we've got the relevant legislation. So we have the two pieces of legislation that underpin the CQC and their assessments, which are the Health and Social Care Act of 2008 and the CQC Registration Regulations of 2009. They make up all of the information that you may be aware of already, such as the fundamental standards and the notifiable incidents that you have to submit to the CQC as part of being registered. So just to reassure you, there have been no legislative updates, which is really important to bear in mind. The 5 key questions that everybody will be hopefully familiar with already, whether or not a service is safe, effective, caring, responsive, or well-led, they're also staying, so they're not leaving, which is reassuring. And then we have the 13 fundamental standards that are made up from the Health and Social Care Act that exists. So they are the absolute, I suppose, minimum or the basic expectations that any good health and social care provider should adhere to. So you may recognise them being referred to as things such as consent, person-centred care, safeguarding adults from abuse. So there are 13 fundamental standards that I would encourage all of you to make sure that you're aware of. They've been around since 2010 and they're not going anywhere. So also a little bit of comfort for you. And then the 4 ratings that you'll all be familiar with if you are already CQC registered. Those are whether or not a service is inadequate, requires improvement, good, or outstanding. So the CQC aren't changing the rating, the way that they rate a service either. But what is changing are the key lines of inquiry. So previously, the CQC recognised that there were hundreds of key lines of inquiry, or CLOEs as people call them, that sat across multiple directorates within the CQC. So, for example, there would have been a long list of CLOEs for a GP practice, a residential service, a hospital ward, a private independent clinic. There were hundreds of key lines of inquiry, and it became quite difficult for health and social care providers to keep up with that. And for the CQC to ensure that kind of services and people were all working towards one single quality kind of standard. So they are removing the CLOEs and instead they're introducing 34 quality statements. These are made up, these form part of the single assessment framework. And what this means is that regardless of what service you're providing, you will all be held accountable to the same quality standards and the same expectations of treatment, of care, of any service delivery. So we'll talk a little bit more about the quality statements as we go through, but yeah, it's important to bear that in mind. And there are also now going to be 6 new evidence categories that exist, and that will inform the way that the CQC look at services, the way that they inspect, monitor, rate, regulate, register, all of those things. So those 6 evidence categories are people's experience of health and care services. They'll be looking at feedback from staff and leaders, feedback from partners. There'll also be an opportunity to do observations, and then they will be looking at processes and outcomes. And then we've also got the scores, which we'll go on to in a little bit more detail in the next slide. But the CQC are going to be using a scoring approach to look at the quality statements and then decide what rating that would mean for a particular service. So in terms of just a little bit more about the way the new strategy will be working and sort of the thinking behind that. So the CQC will be making much more use of information on a much more regular basis. So rather than previously, where you may have experienced an on-site inspection, you would have been able to predict when the CQC were coming, maybe based on if you received an information request or based on your rating that you had previously. They're now going to be using a lot more data monitoring and a lot more frequent assessments of data as the main driver for deciding when they will need to assess you as a service. And that actually ratings and scores can change remotely rather than them necessarily needing to come on site to complete that inspection with you. So the judgments about quality are going to be made much more frequently rather than just after an inspection. And they're hoping, and the new approach will mean that the CQC should be much more structured and transparent, and that there'll be an ongoing public display of the scorings that you receive under the quality statements, so that people know where you stand at any given time. Okay, let's move on. So in terms of the scoring, we can see here that the idea is that for each of the 34 quality statements that you'll be inspected under, there will be a score of 1 to 4, 1 suggesting that there are significant shortfalls, which would align with an inadequate rating, all the way up to 4, where there's an exceptional standard of care being delivered, and that would align with a rating of outstanding. The main thing to consider with the new scoring and the new approach is that you will now need to focus on all of the quality statements rather than necessarily being able to hide behind some of them. So the CQC have said that by using the following rules, they can make sure that any areas of poor quality are not hidden. And so for providers, it's really important that you appreciate that a poor score in any of the 34 quality statements across any of the 5 key questions could bring down the score, the overall scoring for that particular key question, which could ultimately lead to a poorer rating. So you'll no longer be able to dedicate a different amount of effort to different parts of CQC compliance, and instead all areas will require equal attention. So there is a scoring example, this blue link that you see on this particular slide. You will be able to access that after this presentation, and that will take you to an example that the CQC have provided for us about how they will score a GP service. And the idea is they talk about it, you'll be able to kind of go into it in a bit more detail, but the example that they give is under one of the quality statements of infection and prevention control, which sits in the key question of SAFE. They talk about the exact evidence categories, so there's 6 evidence categories that we looked at. There are 4 under infection control that they will look at. They talk to you about how those 4 evidence categories of the 6 are scored, and then how that gives you a total score for that one particular quality statement. Then they show you how all of the quality statements under SAFE are scored, giving you a total for that key question. And then that total equals a percentage, which indicates your rating. So once you've got your head around that kind of new algorithm and that new way of working, there's nothing stopping you as providers sort of doing some map and gap exercises and being able to implement that approach within your own day-to-day business. You know, if we've got registered managers on the call, we've got quality and compliance leads, clinical leads, you can implement that when you're doing your own sort of gap analysis and your own audits of your service. So there's a little bit here just again to support you in, I suppose, hopefully feeling less nervous or worried about the new CQC strategy. So on the left hand side, you can see the list of, they previously were the key lines of inquiry, the CLOEs that we talked about that you may already be familiar with, that sit under the well-led key question. And then on the right hand side, we've got the quality statements that sit under the key question of well-led. Now, hopefully this will reassure you that there aren't too many changes when we look across and we compare the two. And when you read into the detail on the CQC website and as part of the new strategy, hopefully it's nothing that you're not already familiar with and that you're not already embedding into your practice. It's just about reframing, renaming, and having a different way of seeing things. And the new strategy has really focused on, you'll hear about 2 things, the I and the we statements. The I statements are obviously a reflection on the quality of care that patients or people receiving treatment would expect to receive. And then the we statements are what you as professionals, you as providers are going to commit to delivering. So when you read the new quality statements on the right hand side, you'll see that there's much more focus on people being at the centre of care and you as providers committing to a really high quality and delivery of service. But what you will see in the big red thing at the bottom is that there is a new quality statement, the environmental sustainability and sustainable development. So that previously didn't exist within the CQC strategy. So it's really important that that is really well considered as part of your care delivery. As we talked about earlier, what the risk is that if you ignore one of the quality statements, let's say, for example, that you score high, you might score 3s and 4s in the first 7 of those quality statements, but actually then you score a 1 or a 2 in environmental sustainability, there's a risk that you may think that you're good in well-led or outstanding in well-led, but scoring low in one particular area could bring your whole percentage down, and you would automatically then see a requires improvement rating. So exactly how we talked about, you can no longer hide behind areas of strength and maybe some areas that you need to improve on. It's about getting all of them right. And then this here is just a little bit to help you and to lead into Claire and Oscar talking a little bit more about the well-led practice later on in the presentation. But you've got here your quality statements that we've just seen on the previous slide, the 8 that sit under well-led. And then there's a little bit of information underneath about how they align with the well-led practice and the resources that are available on their website, so that when you are accessing that platform and you are accessing the the resources, the information, the guidance, the exercises, all of the really valuable things that sit under the well-led practice, you'll be able to clearly align them then with the CQC expectations. So hopefully it will help you when you're preparing to be CQC ready.
Thank you, Gabby. And as Gabby has pointed out there, number 8, this new one, environmental sustainability, that's what I'm going to come on and talk to you about now, because we're going to give you our top 10 tips on how to achieve this part of the CQC well-led framework, this particular quality statement. And as Gabby put so eloquently, with the current framework, there is no expectation to demonstrate environmental sustainability and working towards that, but there is now with the new 2023 framework. The we statement that is relevant to this says, we understand any negative impact of our activities on the environment, and we strive to make a positive contribution in reducing it and support people to do the same. And as Gabby said, we can't hope that we do well enough at the rest of the well-led quality statements that it pulls us up if we don't focus on this particular quality statement. We could do really well on everything else, but if we miss this entirely, then we're inclined to maybe get a requires improvement in well-led. So we need to focus on it. I've tried now to give you a load of resources that you can go to help you get started in this particular area. So remember, we will be sending you the slides at the end for anybody who fills in our very simple feedback form, and all of these links you'll then be able to click through to. The first thing I've put on there is a Pulse article. It's actually a really good summary of where we're at and where we need to be and why this is now important. I hadn't appreciated 4% of England's carbon emissions actually come from the NHS. So there's going to be more and more push on CQC regulated providers to show that they're doing something about this. And as a bonus, if you read that Pulse article, then you get 1.5 hours of CPD. So you can tick 2 boxes there with 1 CPD article. And maybe whoever in your practice is the most enthusiastic about reading it can then be declared the green champion for your practice. The college have produced a really good resource called their Green Impact for Health tool, which helps you to kind of work towards being green, and you get some certificates depending on what levels you're achieving, but even just some very small steps gives you some awards and things that you can show off. It's got all sorts on there, from prescribing to things that are kind of clinical but not to do with prescribing, like social prescribing, for example, and then also some non-clinical things, particularly around wasting stuff. So that's where we lead into the next resource here, the third one, which is a free calculator for GP practices to use. And this calculates your non-clinical carbon emissions. So the emissions related to what you're using in your premises, the travel of your staff, that sort of stuff, the things that we're sometimes less focused on. We all know now about inhalers and how there are certain ones that we should be using to help the environment, but this is focusing on the non-clinical stuff. And you put in as many or as few details of about your practice as you want, and it will chuck you out a number, which is your estimated carbon footprint, and then you can try and work on it. That's a really useful thing. Something easy to do is you could signpost patients to something called PenCycle. So Novo Nordisk now have a recycling initiative for any of their pen devices, so for insulin and weight management medications. And there are many pharmacies around that will allow patients to recycle them. And you could, if you click through to the website, you can get some free leaflets and posters that you could have in your surgery directing patients to that initiative. I checked in the area that I live in, and there were quite a few pharmacies that were doing it. So that's another one to signpost people to. Don't necessarily have to do all of these yourself. Don't have to recycle the Novo Nordisk pens yourself, but you can tell people where to go. Then there's an asthma toolkit. This one is developed by the RCGP as well. This is more focusing on clinical stuff here to do with inhalers, but there are some ready to go quality improvement projects that you can do as well as part of signing up to that toolkit. So you might be able to use it as part of your appraisal as well as demonstrating well-led. And then there's some other simple tips that I found while I was sort of scouring the internet for what everybody else was doing about this. Simple things like the water cooler that sits in reception or up in the staff room. What kind of cups do you use with it? Any chance you could get rid of the plastic disposable ones and instead use glass ones or ones that are plastic but could go in the dishwasher? Switching your energy to supplier to somebody who declares themselves as only using renewable energy is worth having a look at. And there's a link there for one of the companies that will look at switching you to one of those providers. Recycling stuff that you already have in the practice, batteries, ink cartridges, but then maybe also extending that out to patients as well and saying, hey, you can drop your stuff off here and we will recycle it for you. Thinking about the simple things like turning things off. The number of practices I work in where there are lights on in rooms that people aren't in, or the computer is on standby. It's so much easier to have the computer on standby, let's be honest, because it takes so long to boot up every morning. It's quick and easy for us if we maybe just turn the screen off, but actually it's probably not the right thing to be doing in terms of the environment. And just generally thinking about what we print and whether we actually need to be printing things. Could we instead be using a screen in the corner that has our agenda for the meeting, so everybody isn't having to look at an agenda printed on a piece of paper, for example? Those are some simple steps that you can take that hopefully give you a starting point, at least, in how to start thinking about this environmental sustainability part of CQC WellLed, which as we now understand from Gabby, we really must focus on, and we can't ignore it or pretend it doesn't exist. So I will now hand over to Gary. Okay,
thanks, Claire. Yeah, I'm going to share just my experience, and if you've been through a CQC inspection already, this will probably resonate with you as well. The WellLed part of CQC is the hardest to achieve, along with SAFE. I think that's something that CQC will always declare as well. So in my 13 years as a PM, went through more than one CQC inspection. And in that 13 years, the practice was successful in most of the ways that you judge the success of a practice. You know, we were successful. Our retention and recruitment was very, very good. Rarely had a staff gap when we went out to recruit. We always managed to recruit. We did well financially. Staff morale was always really, really good. We were innovative. There were many things that we were first in the area, and I can even think of one significant thing. We were first in the country, and you know, that's turned out to be something that was rolled out across the country. We even developed our own leadership and management education program that we rolled out internally and also to other practices in the area. As a training practice, we were judged as an exemplar training practice. So all of these things, we were understandably proud of our leadership in the practice, and our team, the peers, commissioning colleagues, other stakeholders, and even many of our patients, you know, I can confidently say they would have said, yep, the leadership in that practice is good. But CQC said we were requires improvement. And if I think back on this, I think that whilst our leadership might have been good, what we weren't doing is we weren't thinking about how CQC assessed that and how we could demonstrate it. So really my takeaway that I would say is that always be thinking, how does what I'm doing demonstrate well led to CQC, and what evidence can I collect to actually support this? Because I think you absolutely may have a great practice, the leadership may be great, but if it's not aligning with how CQC are capturing that, then you may not actually get what you need. The other part, as well as this being tough, the other sort of my takeaway, the other part that always resonates with me is how much time it takes. The CQC assessment for well led looks at a really, really wide ranging number of areas. I counted through the qualities statements, looking at the distinct aspects that are around leadership and management, and there's more than 40. So, and just to make that point, I'm going to read a bit of a list through, and these are all distinct aspects of leadership that you might need to support and evidence. So just bear with me on this. Accountability, collaboration, continuous learning, diversity, environmental sustainability, equity, governance, improvement, inclusion, information security, innovation, openness, outcomes, performance, person-centered care, population needs, quality, risk management, roles and responsibilities, safety, sharing information, strategy, supporting staff, sustainability, values and vision. And that's just a little over 20. So, there's masses that you might be required to evidence. Now, if you may be doing many of these, but the question is, can you provide the evidence? And if, like me, sadly, I learnt the hard way, I wait until CQC are in the area, or worse still, you might wait until you've got notice and then think, right, got to get all that evidence together. But the problem with that is some things you'll have forgotten, and the time for collecting some of that evidence or the opportunity for doing it may have passed. You may not be able to do it. And even if you think, right, I'll just do that now, it's always obvious to the CQC inspectors that you've just done it prior to and because of the inspection. So, I think the thing to take away on this at the time is there's only one way to do it, and that's to do it as you go along. Think about the evidence you need to collect, those questions that I sort of said on the previous slide about how does this demonstrate well led to the CQC, and what evidence can I collect that as you go along. So on that, I'm going to hand over to Oscar Matthew. He's going to talk through the well led platform, which will help with this.
Thanks, Gary. Hello again, everybody. So the idea with the well led practice platform is a little like Gary said, to help you in this particular way to review and assess how you're doing in well led, and then link you up with things that you can do to improve, and then help you evidence it down the line. So it's a kind of preparatory piece for well led. And the platform that we provide to practices and to PCNs, federations, is something that you do yourself. So it's run by you at your own time scale, and they're digital processes. And there are really kind of three things that we provide. The first is this well-led review, which is an overview snapshot, if you like, of how things are going. So it'll tell you what's going well, where your strengths are, the areas in which you might want to focus some more attention, and your development priorities. Link you up with some exercises and approaches to improve those things. And it's all linked to the new CQC criteria. So everything that we assess against is in the well-led criteria somewhere. We've also got a part of the platform which is dedicated to individual development, which are constructive, reflective practice 360s. So they're not kind of performance management 360s, but they are things that people can use at appraisal to think through, as an individual, how am I doing? Where are my strengths and where are my personal development goals this year? And we've got a range of those, from reviews for GP partners and practice managers, clinical directors and PCM managers, but also reviews that are designed to be used by everybody else within the practice and PCN. So we don't just cater to the senior group. It's something that everybody there can use. And all of this is underpinned by a resource section called the Expert Guidance, which has been put together by a couple of academics, one from Imperial and one from Oxford, which is kind of all the things that we know from the evidence on leadership and teamwork you have to be doing well in order to succeed and be well led. And then you have action plans and how-to guides that you can use to kind of focus in on your CQC side of things. And this is based upon a platform that has been used more generally in healthcare. So you see on the right-hand side of the screen there, it's used within Imperial and King's, the Red Cross, other places within central government. And when people use it, they like it, I suppose, is the takeaway. That it's a really effective way of getting clear about your development needs and improving how you work together. So yeah, that's the principle behind it. And in terms of how it kind of works functionally, what you will do if you want to do this is you set it up. It's incredibly quick and easy to do. It takes a couple of minutes to set up, and people are invited to contribute to a diagnostic questionnaire that genuinely takes 5 to 10 minutes to do. They work their way through our criteria. It's smiley faces, it's very accessible. Each person within a practice or PCN will do that. So you'll get this stream of data in from the leadership team, and you'll get a stream of data in from the rest of the practice or the PCN, and then that will be put together, a kind of generated automatically within a review for you to look at. Now, it's completely confidential to you. It doesn't go anywhere else, and it's anonymously done. So, you know, people can feel kind of good about, you know, speaking with candor about the things that are working well, but also where they need to improve. So it gets generated. The idea is normally a leadership team will look at this first, say, what are the messages for us here, create a personal development plan, share it with the practice or the PCN, and then do some development work based upon the suggested development exercises that we give you. So the idea is that you can do this yourself, that this will help you in a structured way, work your way through your needs and improve. So that's the principle behind it. And I think that's pretty much where we rest in terms of the content on this. What we've shown you over the course of this short webinar is, I hope, a useful introduction to the changes, what's changing and what's not changing in the new framework, those tips and resources on the specific thing of environmental sustainability, Gary's insights as a PM, how tricky this territory can be, and then how our platform can help you if you're interested in looking at that. So yeah, that's pretty much where we are, and I'd love to open this up now to questions. So please pop things in the chat and direct it at any one of us, and we'll see what we can do to help.
Thanks, Oscar. We finished this as we'd hoped, with sort of 10 minutes or so to take some questions, and we'd love to answer any questions that you may have, whether it's about the new framework or the well-led platform and how that can help. Pop them in the chat and I'll sort of field them, and we'll get the panel on the call here to help out. So we've got one from Cyrita. So maybe this is one for you, Oscar. Can this questionnaire be done more than once to see if the changes have improved the outcome within the organisation?
Yeah, thanks, Rita. Yeah, absolutely. That's exactly the kind of way that it's designed to be done. So the first time you'll do it, it'll give you a kind of a sense of where you are, where your strengths are in development opportunities, and then kind of we have an anonymous benchmarking system as well, which will give you a very general sense of kind of how you compare to the other PCNs and practices who have done the same process. But what you will do next time, 6 months later, 9 months later, for example, will be to do it again to see what's moved. Are the development opportunities still the same for you? Have you moved on what you've said you were going to do originally? Yeah, so that's exactly the principle behind it, Sarita.
That's great. And Hannah has asked, so Claire, this is one for you, I think. Have ICBs been approached to fund this service for GP practices? And if I was a practice manager, yeah, I'd be really interested in that one.
Yes, not every single ICB in England, I'll be honest, but some do know about it. And I should probably, you can then, understand yourselves maybe what the ICBs have done about it. But There's also PCN funding that you could potentially be using for this. Some federations have purchased this for their practices with a pot of money that they've had sitting in reserve. So I would definitely, if you're interested in it, instead of digging into your own practice money for it first, I would look to your PCN Federation ICB and ask them whether this is something they'd be able to fund. There is the price is per patient, and it varies down to from 15 to 20p depending on the number of patients you're buying it for. So there are advantages to purchasing it at scale. And I've just seen a load of questions come in about costs as well, I think there. So that's
answered that. But Claire, are we going to make the recording of this webinar available afterwards?
We are.
Yep.
So in one of our very final slides, we've got a very quick QR code for you to give us a tiny bit of feedback. And as a result of doing so, you'll then automatically be sent through the slide deck. So you'll have all of the links and everything like that. So no need to be making any notes. Just fill in the feedback and we will send it to you. We'll also email the feedback form to you afterwards anyway. So if you can't do a QR code right now and you've got to whiz off, no problem.
Brilliant. Okay, Gabby, has the new CQC framework been rolled out? And if not, when can we start seeing this new assessment process?
Yeah, so the CQC have updated us mid-September to let us know that they're going to start going live with the new assessments with a very small group of providers from mid-November onwards. And in terms of who's classed as the South region, because they've said that this will cover the South to begin with the commitment that then by approximately March of 2024, it will be a national, it will be applied nationally. So anyone that's based in Berkshire, Buckinghamshire, Cornwall, Devon, Dorset, Gloucestershire, Hampshire, Kent, Oxfordshire, Somerset, Surrey, Sussex and Wiltshire, you are all classed as the South region from a CQC regional perspective. So from mid-November onwards, you may be one of the providers that's assessed under the new framework. And if you're not, don't worry, by March next year, everyone will be, it'll be relevant to everybody. So it's a bit of a transition period, which is why it's important. I think when we spoke at the beginning about the kind of what's changing and what's not changing, I think it's really important that rather than maybe getting scrambled somewhat with the CLOEs versus the quality statements, actually just spend some time understanding the fundamental standards, spend some time understanding the legislation and spend some time getting ready for the quality statements. But I've always said, if you know the legislation, if you know the fundamental standards, then you can't go wrong. So that would be my recommendation during this kind of period of transition.
Okay, that's great. We're getting quite a lot of questions now on the chat, and we're almost certainly not going to get through them all. But what we'll do is we'll try and pick these up and reply to your questions afterwards. So I'm just going to pick out some interesting ones. Can the tool be used primarily online GP provider? Claire, do you want to?
Yes, I see no reason why not. And presumably as an online GP provider, you are CQC regulated and therefore have to be as well led as everyone else. So absolutely, yes. And in some ways it may suit you because we have a digital tool and you're a digital offering. So digital is something that you're very used to, but yeah, absolutely.
And I'm guessing that the question around telemedical service providers, that follows the same for them, much the same. Can how will the new CQC approach fare with telemedical service providers? Maybe Gabby, that's a better one for you.
Yeah, no problem. So I think the main thing to understand, and actually there is a webinar tomorrow for anyone that hasn't yet registered in the afternoon with the CQC, where they're talking about the evidence categories and how they align with the quality statements and for different service types. So for online services, when we think about the 6 evidence categories that they're inspecting under, we can quite clearly probably ascertain that some of them won't apply. For example, observation, that wouldn't be an evidence category that they would be able to use for an assessment of an online service. But all of the other services, people's experience, feedback from staff, leaders and partners, process and outcomes, they would likely be assessed for remote medical services or any remote health and social care service.
That's great. Queen's Court have asked the question, will they be provided with a simulation self-audit tool of the CQC framework in order to assess our work. So I suppose that's about, does Well-Led provide that? I don't know who wants to take that, Oscar or Claire.
Yeah, so I would say that the Well-Led platform provides exactly that, but only in relation to Well-Led. Sadly, we don't cover the other CQC areas, but Well-Led, yes, you're covered.
Okay, and Chris has just asked about a link to the meeting tomorrow that was mentioned. So that's our best practice talk. Do you want to share the details, Claire?
Oh, yes. So some of you we may be seeing it Best Practice tomorrow up in Birmingham. I think it's still registration is still open. You can turn up on the day and register for free. We have a stand. We're at E107 and we're also speaking on day one. So tomorrow of the conference, we're talking about the top 5 leadership challenges that we see practices facing. And we'd love to see you there. We will probably be sharing it on social media, so you won't be missing out if you're not there, particularly if you signed up to our newsletter, Chris.
Come and see us at the stand. There'll be a chance to do a mini self-assessment and you'll really get a taste and a flavour of what the Well-Led platform's like. That's the answer. Nikki's asked about best practice tomorrow. Yeah, we'll be there. Have we got any more questions? I didn't think we were going to get through them all, but I think some of them were the answers that I was seeing and not the questions. Does anybody want anything else? Got anything else they want to ask?
I'm sorry, I just realised Chris was talking about the CQC webinar rather than our best practice. So Gabby has kindly put the link in for that as well. Thank you, Gabby.
That'll probably be really good too, but the best practice one would be very, very good.
Yeah, I think I would only say to people if they're interested in this stuff, the best way to kind of get a hold of it is from the platform perspective is to see it work and to have a go yourself, probably. So if you're interested in it, you can get in touch with us. I think we have a slide to show you, but we can take you through what it looks like in a bit more detail to get to a bit more of a tangible grip on how it works.
And I say as a practice manager, head over to the website. You can get a free trial. You can ask for a demo. There's masses to see. It's well worth doing. So yeah, have a look. You absolutely have got nothing to lose. Claire, I think we're probably finished on the questions. So I'm going to hand over back to you.
Thank you.
Close.
Thanks, Gary. So we do have a slide here with some of our other resources that we think will be useful for you for Well-Led, not just for the environmental sustainability bit, but for the whole Well-Led, ones that we haven't covered elsewhere. And remember, those will be hyperlinks when you get the slides. So importantly for you, if you would like to get the slides, and importantly for us, we'd love to hear your feedback. If you wouldn't mind just scanning this quick QR code, there's just a couple of questions to find out how you found today's webinar, and then you will receive the slide deck and all of those resources. And as Oscar kindly said, we got our website here where we have samples of the reviews and videos running through some of the work that you can do on the platform. And equally on there, you can book demos with us and free trials. So do head over there to have a look. And that's our email address and our LinkedIn. And I'll stand tomorrow for best practice. So we'll definitely be seeing you there, Nikki, but hopefully we'll see some others of you too. We have a mini self-assessment that anyone who's attending best practice can do for free of their own leadership. So on that note, I'll leave that slide up so everyone can do the feedback that's interested in doing so. But it's been really lovely to have so many people here and to have the questions and the interaction at the end there. I hope you found it useful. I certainly have learnt plenty I didn't know about the new CQC framework. Thank you very much to you, Gabby, but also to Gary for so honestly sharing his insights and his experience of being well-led, but perhaps not being able to demonstrate CQC well-led. And it's good to know that there is a difference, sadly. Thank you. Oscar, anything you want to say before we close it all off?
No, I think just saying thank you very much for coming. Nice to meet you, although your cameras are off, so I don't see you, but thank you for coming. Maybe if you do come to best practice, come and say hi. You have to introduce yourselves because I won't recognize you. But thank you very much. Yeah, and see you soon, I think.
And to the person that said they can't scan the QR code, we'll email everybody who's attended the webinar with the feedback form anyway, so you'll be prompted to do it, and then of course you'll get the slides in the same way. Thank you.